Good morning, everyone. Today, for 7th Sem BPharm syllabus, in the first unit, they have described about hospital and its organization. We will see the definition of hospital and remaining things which are related to a hospital. See, the hospital is an institution which provides medical and surgical treatment and nursing care for sick or injured people. In other way, we can say that is built, staffed, and occupied for the diagnosis of disease, for the treatment sick or injured, for their housing during this process. It's very simple. See, if you get injured or sick, we go to this institution for getting the medical and surgical treatment and, of course, the nursing care. And we can classify this hospital according to their purpose, administration, then their building capacity, type of the care, and system of medicine, depending on the region. So in that first, according to purpose, this can be subdivided into three: general, special, teaching or research hospital. General hospital, we will deal all these things, we will discuss all these things in detail. And according to administration, government or semi-government or private hospital. See who is running, who is funding related to that. And what is the bed capacity of this hospital? Based on that, we can classify these hospitals into three: small, that is around 100 bedded, and medium, it is up to 300 bedded, large means more than 300. In some other definitions, they have mentioned like small means 50 to 100. Medium means up to 500. Large means more than 500. In some textbooks, it shows like that also. And depending on the type of care, see, based on care, it can be classified into three: primary, secondary, and tertiary. And based on the system of the medicine, what kind of medicine, what kind of system they are following, whether it is allopathic, Ayurvedic, Unani, then homeopathic, it can be classified into that categories also. Depending upon the region, whether it can be regional, district, sub-district, or rural, there it is located. Now let's see what is primary hospital. See, day-to-day healthcare is given by the healthcare provider and first level of contact between individuals and families within the health system. Primary healthcare serves the community. This primary healthcare centers are very close with this society community. It included care for mother and child, like family planning, immunization, prevention of locally endemic diseases, treatment of common diseases or injuries, then provision of essential facilities like, if we are sick, or in primary healthcare hospitals, when this COVID was high, they used to provide mask, head cap, then gloves, these all kind of things they used to provide. Then health education, primary healthcare center. Then secondary hospitals, second rank of the health system. Patients from the primary healthcare are referred to the specialized in higher hospitals for treatment. See, we won't get all the treatment in primary healthcare settings. So what if the facility is not available? They will send to the higher sector, that is secondary hospitals. There the specialist will be there. He will be taking care of your health, like district hospital, pediatric surgery hospitals and all. But whereas in case of tertiary hospital, they are referred to the third rank of the healthcare system. Here, specialized consultative care is provided usually on referral from the primary and secondary. So from primary, they will refer to the secondary. Even if it is not subsiding, then they will refer that to the tertiary care hospital. Features of tertiary care hospitals are there will be intensive care unit, advanced diagnostic support service, and specialized medical personnel. For example, research centers, medical colleges, cancer hospitals, and all. Now, we can classify these hospitals based on clinical and non-clinical basis, whether or not you treat the patient or provide direct patient care of any type. Then organization structure of the hospital, like large hospitals have complex organizational structure. Small hospitals have obviously simple organization structure. Then organization structure include various staff, services provided, departments, and communities. Then organization structure of a hospital. See, the top of a hospital, what? It is board from their administration. Again, they have subdivided into three: primary services, secondary services, and supportive services. In primary services, what all services they will provide? Emergency care, inpatient, outpatient, operation theater, and ICU. Whereas in case of secondary services, central sterile supply, then dietary, pharmacy, therapy, diagnostic, radiology, nursing, and social. Supportive services, laundry, transport, maintenance, record, education, accounting, and mortuary. Let's see what are those primary services. Emergency services, they provide quick treatment, serious cases or accidental cases treated, sometimes referred to special departments like orthopedic neurology. Outpatient services, examination and counseling in outpatient department, that is known as OPD. Inpatient services, they will be having special rooms and general wards. Patient may get admitted in case of emergency from the OPD. ICU, serious or critical patients will be admitted, and special equipments and trained staffs will be here. Operation theater, surgical procedures undertaken, specialized air filters will be there, specialized central area will be there, cross contamination is prevented. Secondary services, Central Sterile Supply Department, that is CSSD, engaged in supply of sterile materials and instruments. Sterile air supplied here, connected with all the departments, usually connected directly to the OT. Then therapy, treatment of injured diseases, specialized departments for different diseases, specialized to doctors, trained nurses, proper record kept, all patients treated. Thank you.